Okay, good evening, dear students. Let's start our today's section. Okay, today we are going to discuss about Sandhi Rogas. Before that, I am Dr. Kannan. I am working here at Rajkot, Gujarat. Okay, within this 1 hour, we have to discuss about the whole Sandhi Rogas. Can you hear my voice properly? Can you see the PPT?
Yes, sir.
Yes, sir.
Okay. Listen. Okay, today we are going to discuss about Sandhi Rogas. It's a small topic according to related to other subjects. I mean, among other diseases. Okay, we can know that we know about the Netra Sandhis. There are 6 different Sandhis are there. These are Sandhis means these are the joining parts of mainly 2 mandalas. Okay, 5 different mandalas are there. The joining parts of the mandalas, that area we can call it as Sandhis. Okay, 6 number of Sandhis are there in our Akshi or Netra. Okay, what are the Pakshma Vartma Gada Sandhi, Vartma Shukla Gada Sandhi, Shukla Krishna Gada Sandhi, Krishna Drishti Gada Sandhi, Kanina Sandhi, and Apanga Sandhi. These are the 6 different Sandhis in our eye. Okay, so come to the Sandhi Gada Rogas. According to Susrutacharya and Vagbhadacharya, the number is same. 9 different types of Sandhi Gada Rogas are there. According to Susrutacharya, the names are like this: Puyalasa, Sa Upanaha, Srava, Parvanika, Alaji, Krimigrandhi, Savijnaya, Roga, Sandhigata, Navaha. Okay, the name is also same for Vagbhadacharya: Puyalasa, Upanaha, Srava Rogas. Okay, Parvanika, Alaji, and Krimigrandhi. There are 4 different Srava Rogas are there. So total there are 9 Sandhigata Rogas are there. Okay, so come to the Sadhi Rogas among them. Among the 9 Sandhigata Rogas, 4 are Sadhi Rogas. It's curable, or with some techniques, some Shastra Karmas, we can cure the disease. Okay, what are they? What are the Sadhya Rogas among the 9 Sandhigata Rogas? Okay, Puyalasa, Upanaha, Parvani, and Krimigrandhi are the 4 different Sadhya Rogas among the Sandhigata Rogas. And the remaining 5 Rogas, total 9 diseases are there in Sandhigata Rogas. Okay, and the remaining 5 are Asadhya Rogas. What are they? 4 different types of Srava Rogas and allergy. Okay, so sometimes the questions may ask like this: write about the Sadhya Rogas among Sandhigata Rogas, or write about the Asadhya Rogas among the Sandhigata Rogas. So we should know that only 9 diseases are there in Sandhigata Rogas. Okay, among them 4 are Sadhya: Puyalasa, Upanaha, Parvani, and Krimigrandhi, and 5 are Asadhya Rogas. Okay, what are they? 4 different types of Srava Rogas and allergy. See, one by one we have to see the diseases. Okay, we have to see the signs and symptoms told by our acharyas and some modern correlation and the treatment. Okay, first disease we are going to discuss about Puyalasa. Puyalasa. Okay, so how Acharya described about Puyalasa? See, according to Vagbhadacharya, the sloga is like that: Puyalasa Vrana Sushma Shobha Samramba Purvaha. Okay, Kanina Sando Atmai Puyasravi Savedana. So Puyalasa means at first means there will be a swelling will be there, and Sushma Vrana, some pustules will be, pus discharge will be generated with a orifice, with a mouth. Okay, Puyalasa Vrana Sushma Shobha Samramba Purvaha. Hello, slide is not changing.
No, doctor.
1 minute. Now changing or not? Slide is changing or not?
Yes, now it's okay.
Now it's okay, na?
Yes.
Okay. Thank you. Okay, see. So we are started with Sandhi. Netra Sandhi is the joining area of mandalas. There are 6 different Sandhis are there. just tell the names of different sandhis, and there are 9 different Sandhigata Rogas are there. The number is same for Susrutacharya and Vagbhadacharya. So what are they? Puyalasa, Upanaha, Sravarogas, Parvani, Allergy, and Krimikiranti. These are the 9 different Sandhigata Rogas. Okay. Among them, what are the Sadhi Rogas? How many are Sadhi Rogas? Okay. What are the Asadhi Rogas? And among the 9 different Sandhigata Rogas, 4 diseases are Sadhi Rogas. Puyalasa, Upanaha, Parvani, and Krimikiranti are the Sadhi Rogas among the Sandhigata Rogas. Okay. What are the Asadhi Rogas? 4 types of Srava Rogas and allergy are the among them. Among the Sandhigata Rogas, these are the Asadhi Rogas. So totally there are 4 Sadhi Rogas and 5 Asadhi Rogas among the Sandhigata Rogas. First we are going to discuss about Puyalasa. See how Acharya described about Puyalasa. Puyalasa Vrana Sushma Shobha Sambramba Purvaka Kanina Sando Atmai Puyasravi Savedana. So in Puyalasa is a Sannivadaja Vyadi. There is a swelling. Swelling will be erased near to the Kaninaka Sandhi, near to the medial canthus. Okay. So at first there will be a swelling and Vrana Sushma Vrana will be originated. Some pus point will be originated. Okay. And Kanina Sando Atmai Puyasravi Savedana. When it is open, Puya will be discharged, the pus will be discharged with pain. Okay. So Acharya described like this. Puyalasa, there will be a swelling over the Kaninaka Sandhi at the medial canthus and with the pain when it is inside, when when it opens, pus will be discharged. Okay, with the pain. And same like that only, Acharya Susruta also described about that. Pakka Shobha Sandhija, Samsaravedya Sandram, Puyam Pudi, Puyalasa. Means here also Acharya Susruta also described like that. Kaninaka Sandhi, there will be a swelling and pus discharge with foul smell will be discharged from the swelling. Okay. So there will be infection, suppurated swelling will be there in the Kaninaka Sandhi and the pus discharge will be coming out from the opening. Okay. So Puyalasa is one among the Sandhigata Rogas and this is a Sannipadaja Vyadi. From this picture we can identify. See, there is a swelling near the medial canthus, that is Kaninaka Sandhi, and there you can see a pus point. Okay. So Vrana Sushma, Puyalasa Vrana Sushma, Shobha Samramba Purvaka, Kanina Sando Atmai, Puyasravi Savedana. Okay. So that is, we have discussed that the Puyalasa is a Sannipadaja Vyadi and the site is Kaninaka Sandhi or medial canthus. And Acharya described about this is a Vyadana Sadhya Vyadi. Vyadana Sadhya Vyadi. Okay. Excision should be done. No, Siddhaveda should be done. Siddhaveda should be done for the as a treatment of this disease. Okay. For how we can do this treatment. Okay. For before doing any Shodhana therapy, means doing some Siddhaveda, we have to do Sharira Shodhana. After that, we can apply some Upanaha Sveda over that area and Jakta Mokshana. Okay. In Ashtangradi also Acharya told about this Jakta Mokshana. And after that, we can apply some Anjanas. Okay. Different types of Anjana with Kasisa, Saindava, Ardraga, like that of medicines we can apply over that. Okay. See, Siddhaveda is indicated. Siddhaveda is indicated in Puyalasa. Okay. So, if it is not treated properly, that may lead to Pillarogas. Pillarogas is another topic. If it is not treated properly and if it is not cured properly, that will may lead to Pillarogas. And after the Vedana, after when we are doing some Siddhaveda and some incision and drainage, and Nadi Prana Chikitsa should be done. See, in this picture, a opening is generated, pus point is generated, and pus is discharged from that swelling. Okay. And we are incision inside the wound, inside the swelling, and we are draining out the pus from the swelling. Okay. So after this Shastra Karmas, we have to do it as a Nadi Prana Chikitsa. Okay. So this is the general treatment method described by our Acharyas. So before going to the modern correlation, we should know about the anatomy of the lacrimal apparatus. Okay. So in Puyalasa, there will be a swelling near to the medial canthus at the Kaninaka Sandhi, and sometimes there will be a pus point at that area, and when it is open, pus will be discharged with pain. Okay, so this disease we can correlate with dacryocystitis. Dacryocystitis is nothing but that is an inflammation of the lacrimal sac. Okay, what is lacrimal sac? From this picture, you will get an idea about the lacrimal apparatus. Okay, the lacrimal gland that is situated on the superior and lateral area of the eyeball. From there, the major portion of the tear is originated, and from it is originated and it is covering all over the eyeball, and it is reaching the medial canthus. The tear is reaching the medial canthus, the Kaninaka Sandhi. From there, through the puncta, it is going into the lacrimal sac. Through there, through the nasolacrimal duct, the tear, that is the secretion, is going into the nose. This is the normal pathway of the lacrimal apparatus. Okay, so what is dacryocystitis? That is the inflammation of the lacrimal sac. Here in picture, you can see the lacrimal sac. So because with any cause, if there is any inflammation is caused in the lacrimal sac, then the disease is called as dacryocystitis. Okay, so this Puyalasa we can correlate with dacryocystitis. There are different types of dacryocystitis are there. First one is congenital, and second one is adult one. So congenital, from the name itself we can understand that that is due to the failure of the congenital failure of the nasolacrimal duct. Okay, from the lacrimal sac, the tear that should be drained into the nose through the nasolacrimal duct. If there is a failure of the canalization of the nasolacrimal duct, the tear that won't go into the nose. Okay, so due to the congenital deformity of the nasolacrimal duct, the tear production that won't go into the nose, and that will be collected in the lacrimal sac. Okay, and that may lead to the congenital dacryocystitis. Okay, that is a congenital deformity. So definitely that will cause in neonates. So that is also known as dacryocystitis neonatorum. Okay, so congenital one is due to the failure of the canalization of the nasolacrimal duct. So sometimes some treatment like pressure over the sac area, when we are applying some massage over the sac area from externally, sometimes some relief from this problem, or otherwise we have to do some probing through the duct. Okay, these are some techniques for relieving this problem. And then from this picture you can see the swelling over the medial canthus due to the dacryocystitis. Different, sometimes it may be a congenital one, in some pictures it may be an adult one. In some pictures you can see that pus is discharged from the puncta. Okay, red swelling is over the medial canthus due to the inflammation of the lacrimal sac. Okay, so then comes to the acute dacryocystitis. That means the adult one, acute dacryocystitis. From the name itself, we can understand that acute inflammation of the acute suppurative inflammation. There will be an infection, the pus will be formed. Okay, acute suppurative inflammation of the lacrimal sac, and that will be painful. From the picture itself, we can understand that from the adult one, we can see that pus is discharged from that area. That is redness will be there, and that will be tenderness will be there. That will be a painful condition because that is an acute infection of the lacrimal sac, acute suppurative inflammation. Okay, so pus will be discharged, pus will be generated. Okay, and what are the causes? What are the causes for this acute dacryocystitis? So sometimes most of the patients, the chronic dacryocystitis is a major problem. So acute condition, acute dacryocystitis may be the manifestation of a chronic condition. Okay, acute presentation of a chronic dacryocystitis, that may be an etiology, or acute infection that may spread from a neighboring structures. Sometimes the infection may spread from paranasal sinus, dental abscess. Okay, that infection may spread from the neighboring areas into the lacrimal sac. Okay, so these are the main etiology for the acute dacryocystitis. And the causative organisms, we know that streptococcus, staphylococcus, and pneumococcus, like that. So what are the pathologies happening inside the lacrimal sac? So definitely that is a suppurative inflammation. So pus will be generated, pus will be filled in the sac, and the inflammation that will be spread in the tissues of the sac, and that may cause pericystitis and lacrimal abscess formed. So then due to the infection, the pus is generated inside the lacrimal sac, And because of the infection, the inflammation spread into the tissues of the sac, causing pericystitis. Okay, the sac wall is inflamed. Okay, and after that, sometimes the abscess will be formed, and that may burst over the skin. In some picture, you can see that after due to the infection, the abscess is burst, and that formed an opening into the external appearance. Okay, externally that will form an opening, and the pus will be discharged through that opening. Okay, so in acute dacryocystitis, the pus will be formed due to the infection, due to the above cell organisms, and due to the etiology of the above cell causes. Okay, the pus will be generated, and that may cause the pericystitis. And when it is not treated properly, that may form as an abscess, and the pus will be burst over the skin through a opening or a lacrimal fistula. Okay, so these are the acute dacryocystitis. And what will be symptoms? Definitely there will be pain and sensation of heat, tenderness over that area, fever, and watering or pus discharge through the eyes. And what will be the signs? Swelling and redness over the sac area, edema of the skins and the lids. Okay, and skin over the sac area that will be tender, hot, congestion of the conjunctiva, and due to the infection, the submaxillary lymph node will be enlarged. These are the common signs and symptoms for the acute dacryocystitis. If it is not treated properly, that may lead to orbital cellulitis, facial cellulitis, osteomyelitis of the lacrimal bone, like that. Okay, so this is acute dacryocystitis, and signs and symptoms, and what we can do. And before the abscess formation, some hot compressors or systemic antibiotic or anti-inflammatory drugs that will reduce the symptoms. Okay, and when the inflammation has localized, the abscess is formed, and then we have to incise over the sac, and we have to drain out the pus from that area, or otherwise we have to remove the whole sac, and we have to excise the fistula. Like that only our acharya is also told like this, incision and curettage, like this. Okay, so some hot compressors, systemic antibiotics, and when the edema is formed as an abscess, we have to incise and drain out the pus from that area. Okay, and we have to excise the fistula also. This is the general treatment method for the acute dacryocystitis. Then come to the chronic dacryocystitis. This is the most common dacryocystitis than the acute one. So this is common means than acute one. Generally affects the 40 to 60 years of age people, more in females, and more in lower socio-economic people. Okay, that may be bilateral, unilateral, and more in lower socio-economic group, more affecting the females among the age group of 40 to 60 years. The causative organisms is same as that of the acute one, Staphylococcus, Pneumococcus, and Streptococcus. See how the pathology is going on. See, due to some inflammation, there will be a stricture of the nasolacrimal duct. The nasolacrimal duct is narrowed. Okay, and that may cause the stagnation. The tear that will be held for more time, and that won't be drained out properly into the nose. Okay, the tear that will be stagnated in the sac, and that may create the infection. And if the infection is chronically present, the sac wall will be inflamed. Okay, and the contents of the sac, due to the infection, at first it may be watery, and later it became mucoid, and later it became mucopurulent. Okay, so the discharge will be changed. At first, at the first stages of the infection, sometimes the watery discharge may come. Under the progress, during the progress, the discharge will be mucoid type, and after sometimes it will be mucopurulent type. Okay, here the nasolacrimal, due to the stricture, due to the narrowed nasolacrimal duct, the contents of the lacrimal sac, the contents, that means the tear that won't be drained out properly into the nose. Okay, so that will be kept it there, and that will create the infection, and the lacrimal sac wall became inflamed. Okay, so what are the symptoms? The common symptom is, we can see that watering from the eye. There won't be that much tenderness or pain won't be there in chronic dacryocystitis. See, in clinical signs, we can find different stages. Okay, in catarrhal stage, see in the first type of infection, first stages, there will be a watery type of discharge will be there due to the infection in the sac. There will be mild conjunctival congestion or hyperemia near to the inner canthus, near the medial canthus. There will be congestion of the conjunctiva will be there. When we are applying some pressure over the lacrimal sac area, there will be some discharge will be come out, or sometimes there will be no discharge. Okay, the discharge will be somewhat watery type. Okay, and there will be that much tenderness, there won't be that much swelling will be there. Okay, when this progressing next stage, mucosal stage, swelling over the sac area will be increased and the sac will be distended, and the regurgitation, when we are applying some pressure over the medial canthus, mucus discharge will come. Okay, and these are the stages. When the stage is next to pyosil stage, okay, the conjunctival hyperemia means near to the medial canthus, that will be more reddish in color. And when we are applying some pressure over the medial canthus, mucopurulent pus discharge with mucus that will come out through the puncta. These are the clinical signs, different stages of the chronic dacryocystitis. Okay, then what may be the complications of the chronic dacryocystitis? So, due to the different recurrent attacks, that may lead to acute dacryocystitis, and sometimes it may lead to corneal ulcer, and chronic conjunctivitis may also happen. So what are the treatment we can do? So sometimes some lacrimal syringing that may give some benefits. Otherwise, we can do some catheter, balloon catheter dilatation inside the nasolacrimal duct, or otherwise two surgical procedures are there: dacrocystorhinostomy and dacrocystectomy. In dacrocystorhinostomy, we are making a new hole without because the nasolacrimal duct that is narrowed, so we are making another hole from the lacrimal sac into the nose. In dacrocystectomy, we are totally removing the lacrimal sac. So we are discussing the Puyalasa. So Puyalasa can be compared with the dacryocystitis, and there are different types of dacryocystitis are there: congenital one, acute one, and chronic one. Okay, so according to the condition, the Puyalasa means there will be a swelling near the medial canthus, and there will be some pus point will be there, and when we are incising the wound, the pus will be discharged. Okay, the pus will be discharged with the pain. Okay, according to the condition, we can compare with dacryocystitis. These are the different types: congenital, acute one, and the chronic one. Okay, when it is a chronic one, some two different techniques of surgeries are advised to cure the problem: dacrocystorhinostomy and dacrocystectomy. Okay, we already told that in dacrocystorhinostomy or DCR operation, we are making a new hole from the lacrimal sac into the nose. Okay, that can be done with the two different techniques, means in conventional method from the external approach, or otherwise we can do it as endonasal dacrocystorhinostomy. Okay, these are two different techniques. I think the surgical procedures won't ask any exams. Anyhow, just to go through these topics. Okay, in conventional method, these are some step by step. We have to do anesthesia, we have to do skin incision, and we have to expose the palpebral ligament, and we have to expose the lacrimal anterior lacrimal crust, and we have to dissect the lacrimal sac, and we have to expose the nasal mucosa, and we have to drill one new hole from the lacrimal sac into the nose. Okay, these are the different steps for the operation, dacrocystorhinostomy. And in dacrocystectomy, we are totally removing the infected or inflamed lacrimal sac. Oh, these are the steps. Anesthesia should be given, skin incision should be done, and we have to expose the medial palpebral ligament and anterior lacrimal crust. Okay, and we have to totally dissect and remove the lacrimal sac, and we have to curettage the bony nasolacrimal duct, and we have to close that. These are the simple steps for doing the dacrocystectomy. Okay, so the first disease is Puyalasa. Puyalasa Vrana Sushma Choba Sambramba Purvaga Kanina Sando Atmai Puyasravi Savedana. So according to this condition, we can correlate with dacryocystitis. So Susratajarya and Vagbhadacharya told same, almost same about this disease. Okay, there will be swelling near to the medial canthus or Kaninaga Sandhi, and the pus will be discharged from that area, with the foul smell and with the pain. Okay. And this is a Sannipada Vyadi, it's a Vedana Sadhya Vyadi. Okay. So come to the next disease. Upanaha. Puyalasa, Upanaha, Srava, Parvaniya, Allergy, Krimigrandhisya Vidya. These are the 9 different Sandhigata Rogas. Okay, Upanaha. How Acharya Vakpadacharya told about Upanaha. Okay, Kapena, Shoba Tishnagra, Shara Budbudogama. Shara Budbuda Ubama means it's like a Shara Budbudaga means like a bubble. Shara Budbudogama means like a bubble of the Shara. Okay. Prudumula Bella Stigda Savarno Prudupichila Mahan Apaka Kanduman Upanaha Saniruja. So from the definition we can understand that this is a Kavaja Vyadi and there will be a swelling will be erased like that bubbles of a shara, boiling shara, there will arise some bubble, there will arise some swelling over the Kaninaga Sandhi. Okay. So in Sustrata Samhita also Acharya told like that only, but there's the site is somewhat different. Okay. So Grandhi na Alpo, Drishti Sanda Apaga, Kandu Prayo, Niruja, Sa Upanaha. So Acharya Sustrata told like this, there will be swelling, not that much small, at Krishna Drishti Sandhi. Okay. And that is non-suppurative. There won't be any pus discharge and with mild itching and without any pain. Okay. So Acharya Sustrata told like this, but Acharya Vakpada told like this means Kavena Shoba Tishnagra, Shara Budbudoma, Pridumula Bella, Snigda Savarno, Mrudu Pichila, Mahanapaga, Kandu Man Upanaha, Saniruja. Means due to the vitiation of the Kaba, there will be a swelling near the medial canthus and Pridumula, the root will be strong and with Bella, Snigda, Savarna, that color will be similar to that area. Mrudu and Pichilatva will be there. And the swelling will be not that much small. And Kandutum will be there, itching will be there. And Niruja, without pain. Okay. So, Acharya Vakpada described about Upanaha like this. Like that, a Shara Budbuda, like bubbles of a Kshara, there will be arise some swelling near the Kaninaga Sandhi due to the vitiation of the Kapha dosha. But in Sustrata Samhita, Acharya told that there will arise some swelling, not a small one, at the Krishna Drishti Sandhi. Okay, that won't be a suppurative one. There won't be any pus discharge with mild itching and without pain. Okay, there are some slight difference between the definitions of the two Acharyas. So, this is due to the vitiation of the Kapha dosha and it's a Vedana Sadhya Vyadi. And before doing Vedana Karma, we have to do Sedana and we have to do Vedana incision with the Vrihi Mugha Shastra. And after the Vrihi Mugha Shastra Vedana, we can do Lekhana with Mandalagara Shastra. Okay. And after the Lekhana Karma, we can apply some medicine. Means Pradisarna can be done with this Pipali, Saintava and Madhu. Okay. And after that, we can clean the part with the warm water, or we can use some decoction, or we can use some Kwada or Kashayas. Okay. And we can clean that area with the ghee and massage with the ghee and honey, and after that we have to bandage that area. So this is Kabaja Vyadi, Shastra Sadhya Vyadi, and Vedana Karma is advised to cure Upanaha. So Vedana Karma, before doing Vedana Karma, we have to do mild Sedana over that area. With the Vrihi Mugha Shastra, we have to do Vedana, and after the Vedana, we have to do scraping. Lekhana Karma should be done with the Mandalagara Shastra. And after the scraping it properly, we have to do some Pradisarana. We have to apply some medicines with the Pipali, like that of Pipali, Saintava and Madhu. And we have to, after that, we have to clean that area. We have to sprinkle some ghee over that area. And we have to massage with ghee and honey. And we have, after that, we have to bandage that area. So, Upanaha is a Kabaja Shastra Sadhya Vyadi. Vedana Karma is advised. Okay. Vedana Karma is advised for curing the Upanaha. So, Upanaha is, according to Sustrata and Vakpada, there are mild difference in definition. So when we are taking the definition of the Sustrata, we can correlate with the iris cyst, can be correlated with iris cyst. So iris cyst means that is an epithelial lined space inside the iris. In this picture, you can see that there will be a small swelling in the iris. Okay, so iris cyst, according to Sustracharya, the swelling that can be happen at the Krishna Drishtigata Sandhi. So according to this definition, we can compare that the Upanaha can be compared with this iris cyst. Okay, and there will be a swelling, epithelial lined space. Okay, that involve the layers of the iris. In the speaker, you can find a swelling. Okay, in the iris. This can be compared with Upanaha. There are different types. Are there primary type of iris cyst are there? Secondary types of iris cyst are there. Okay, secondary types maybe happen with after some surgeries. Okay, and treatment, if you are considering fine needle aspiration, some radiation and surgical removal also advised for curing the iris cyst. If you are considering the Vagbhata Acharya told that there will be a swelling like that Shara Budbudha. That means there will be a swelling near, means the color will be similar to that of area, and that will be, the swelling will be near to the Kaninaga Sandhi. So when we are considering that definition, we can compare this Upanaha with a cystic swelling in the medial canthus. A cystic swelling in the medial canthus can be compared with Upanaha. Okay, according to the Vagbhata Acharya. Okay, in this picture you can see that there will be swelling near the medial canthus. The color will be same as that of the area, and Prudumula, the root is somewhat strong. Okay, like that of the definition of Vagbhata Acharya. And Snigdhatam will be there, Savarnatam will be there, Mrudu will be there, Pichilatam will be there. Okay, so Upanaha is a Kabaja Vedana Sadhya Vyadhi. According to the definition, we can sometimes we can correlate with some iris cyst, or otherwise we can correlate with the cystic swelling of the at the medial canthus. Okay, so next comes a part of diseases, Netra Srava. Okay, Netra Srava. There are 4 different types of Srava Rogas are there. Let's see how the Samprapti is told by Sustracharya. See, Gatva Sandhin Asrumargena Dosha Kuryu Sravan Rukminian Kanina. That means due to the vitiation of the yoga, means the doshas get vitiated, and that will go into the Asru Marga, and that is creating the Netra Srava Rogas, and that is reaching the Sandhis. Okay, due to the vitiated doshas, and the vitiated dosha that is going the Asru Marga, and that is causing the Netra Srava from the Kaninaga Sandhi. And some acharyas call it as Netra Nadi. Okay, Gatva Sandhin Asru Margena Dosha Kuryu Sravan Aruk Vihinan Kaninat. Okay, then by Sravan Netra Nadi Adhyega Tasya Linga Kirtiyesha Chadurtha. There are 4 different types of Netra Sravas are there. According to some acharyas, we can call it as Netra Nadi. Due to the vitiation of the dosha, that is approaching, that is reaching the Asru Marga and reaching the Sandhi, especially Kaninaga Sandhi. And from there, the discharge is coming out. Okay, without any pain, without causing the pain. Okay, so some scholars, some acharyas calling these Srava Rogas as Netra Nadi. Okay, so then comes to the different types of Srava Rogas. So Acharya Susrita and Acharya Vagbhata describe about 4 different types of Srava Rogas. First one is Puya Srava. So from the name itself, we can understand that Puya will be discharged. Pus will be discharged from the Sandhi. Okay, Puya Srava. Vagbhata Acharya describes as Puya Sravo Mala Sasra Varma Sandhe Kaninagat Sravayandi Muhu Puyam Sasram Tuk Mamsa Pagada. See, Puya Srava, that is due to the vitiation of the all the doshas and dekta, and pus will be generated. Puya Srava Mala Sasra Varma Sandhe Kaninagat. From the Kaninaga Sandhi, Puya will be discharged. Okay, Sravendi Muhu Puyam Sa Asram Tuk Mamsa Pagada. Due to the vitiation, the Tuk and Mamsa will be affected due to the infection. Okay, and the pus will be discharged, and pus will be discharged mainly from the Kaninaga Sandhi. So, suppuration at the fornices and exudes pus will be discharged and different nature. So, this condition is called as Puya Srava. Puyasrava, in that condition, Puya, pus will be discharged mainly from the Kaninaka Sandhi due to the vitiation of Tridoshas and Dekta. Okay. And due to the vitiation of Top Mamsa. Okay. So Puyasrava is described like that. Then comes the Shleshmasrava. From the name itself, we can understand that Shleshmasrava, Shleshma is discharged. Okay. Kavat Kavasrevam, Chedam Pichilam Behalam Srave. Due to the vitiation of the Kappadosha, see, Shleshma will be discharged, and that will be the Srava means Srava that exudes. The discharge will be like that of whitish in color, thick in nature, slimy in nature, and without any pain. Okay, Kapha Srave, Shvetam, Pichilam, Behalam Srave, and large quantity of discharge will be come out from the Kaninaka Sandhi. So Puyasrava, from the name itself, we can understand that Puya will be discharged. Pus will be discharged. Shleshmasrava, from the name itself, we can understand that Shleshma will be discharged. Okay. Shleshma means thick whitish color of discharge will be coming out from the Sandhi without any pain. Okay. So that is Shleshmasrava. In Dektasrava, from the name itself, we can understand that Dekta is coming out due to the vitiation of Dekta Doksha, Dekta Srave, Tamram Behushnam Cha Asru Samsravet. Okay. Due to the vitiation of the Dekta mixed with the discharge is coming. Tamram, the discharge is somewhat like that of Tamra color, coppery in nature. Behushnam, somewhat in increased temperature, the hot in temperature. Okay. Asru Samsravet. This type of discharge is coming out in Dektasrava due to the vitiation of the Dekta Doksha. Dekta mixed with the discharge is coming out, the Sandhi. And then the discharge, the Srava Roga is called as, we can call it as Dektasrava. And the discharge will be warm, hot in nature. Okay. And not very thicky, somewhat watery in nature. Okay. So this type of discharge is called as Dektasrava. The fourth one is Pittasrava. The name itself we can understand. Pitta is discharged. Sushrutajarya only told about Pittasrava. Instead of Pittasrava, Vakpadacharya included Jalasrava. Okay, there are only 4 different Srava Rogas are there for Sushrutajarya and Vakpadacharya. Puyasrava, Shleshmasrava, Dektasrava and Pittasrava for Sushrutajarya. Puyasrava, Shleshmasrava, Dektasrava and Jalasrava for Vakpadacharya. Pittasrava, how he described? Pidabasam, Neelam, Mushnam, Jalavam, Pittasravam, Samsravet, Sandhimatyal. From the middle area of the Sandhi, the discharge is coming out with a color of Neela. The color will be somewhat like the bluish discolored discharge is coming. Okay, bluish colored discharge is coming with hot in potency and watery discharge. Somewhat watery discharge is coming from the Kaninaka Sandhi. So Pittasrava, from the name itself, we can understand due to the vitiation of the Pitta, the discharge is coming out like that of the color is like that bluish color and hot in nature, and from the Kaninaka Sandhi discharge is coming. So according to Vakpadacharya, he's included Jalasrava instead of Pittasrava. How he described Jalasrava? So here Jalasrava Vada dosha is important due to the vitiation of the Vada dosha. Vayu Kruddha Sira Prapya Jalabam Jalavahini Asru Sraved Vatma Shukla Sandhe Kaninagat. Then Netram Saru Daga Shobam Chat Jalasrava. Due to the vitiation of the Vada dosha and the Vada vitiated, and that reaches the cirrus and producing watery discharge from the Sandhis, mainly from Kaninaka Sandhi. From the medial canthus, watery discharge is coming out due to the vitiation of the Vata dosha and without any, and sometimes it may be associated with pain, some redness will be there, swelling will be there. Saruk Raga Shobam. Saruk Raga Shobam. So sometimes there will be pain, Ragam, redness will be there, Shobam will be there, some swelling will be there. These are the different Srava Rogas. So for the Sushrutajarya and Vakpadacharya, there are only 4 different Srava Rogas are there. Puyasrava, Shleshmasrava, Dektasrava and Pittasrava for Sushrutajarya, and Vakpadacharya included Jalasrava instead of Pittasrava. So Puyasrava, Shleshmasrava, Dektasrava and Jalasrava for Vakpadacharya. Okay, these are the 4 different types of Srava Rogas. All the Srava Rogas are Asadhya one. All the Srava Rogas are Asadhya Rogas. But we can apply some treatments. All these Srava Rogas are asadhya, told by our acharyas. But we can do some local application. We can do some Sega procedure with Triphala Koda, like that. Hello? And Netra Savas, this Srava Rogas, this discharge, whether it is pus discharge, Uya Srava, Sleshma Srava, Rekta Srava, Pitta Srava, or Jala Srava, any type of, so many different types of Srava Rogas are there. Different types of discharge is coming out from the Sandhi, mainly from the Kaninaga Sandhi, mainly from the medial canthus. So this is a vast disease. So we can correlate with, sometimes we can correlate with the dacryocystitis, or sometimes we can correlate with the epiphora according to the condition. So we already discussed about the dacryocystitis due to the infection in the lacrimal sac. Sometimes there will be watery discharge, sometimes there will be muco discharge, sometimes there will be pus discharge. Okay, according to the condition, if there is a jalasrava due to the vitiation of the vata dosha, the jalasrava will be there, watery discharge will be there. Then we can compare with the dacryocystitis in the first stage. Watery discharge will be coming out in the dacryocystitis. We can compare with that condition, or otherwise we can compare with epiphora. Okay, we already discussed about dacryocystitis. Then come to the epiphora. Okay, so the watering of the eye, that from the word meaning itself we can understand that watering means the overflow of the tear from the conjunctival side. Normally the water, the tear production, that will be from the lacrimal gland, and that will be covering over the globe, means eyeball, and it will reach the medial canthus. From there, that will go into the lacrimal sac through the lacrimal puncta, and from there that will go into the nose through the nasolacrimal duct. Okay, so this is a normal pathway. If there is an overflow with any cause, there will be a overflow of the tear from the conjunctiva, side, then we can call it as watering of the eye. So there are two different conditions are there: hyperlacrimation and epiphora. Hyperlacrimation means hyperlacrimation, that means over secretion of the tears. Epiphora means the tear production is normal, but the outflow is disturbed. There will be obstruction of the outflow into the nose. Okay, so there are two different conditions for the watering of the eye: hyperlacrimation and epiphora. Hyperlacrimation, that is a condition where overproduction or over secretion of the tear is happened, and epiphora means the condition, the secretion is normally produced, but there will be an outflow, there is disturbed outflow, obstructed outflow of the tear is there. Okay, so what are the etiology, what are the causes for hyperlacrimation? So first one is primary hyperlacrimation, because primary hyperlacrimation, that means there is a condition in due to some benign tumor in our lacrimal gland, there will be over secretion, overproduction of the tear will be happen. That is called as primary hyperlacrimation. And reflex hyperlacrimation, see, if there is any foreign body in our over the lids or conjunctiva, if there is any inflammation or infection in any part of the area, lids, conjunctiva, cornea, sclera, or uveal tissue, any part of the area, or because of some glaucoma, endophthalmitis, panophthalmitis, due to this condition, overproduction of the tear will come. Okay, that is called as reflex hyperlacrimation. Any defect or any diseases or any foreign body in any part of the area, lids, conjunctiva, cornea, sclera, uveal tissue, due to the reflex from that area, hyperlacrimation will come out. Okay, overproduction of the tear will come out. And central lacrimation, due to the central area, due to some emotional stress, due to that also hyperlacrimation may come. These are the main three etiological factors for hyperlacrimation. Okay, then come to the epiphora. Epiphora, we already discussed that. In epiphora, the tear production is normal, but the outflow from eye into the nose, the tear is not drained out properly. There are some obstructions. There are some obstructions in that area, in the pathway. So there are two main causes are there. Some physiological obstructions are there, and some mechanical obstructions are there. Physiological causes may lead to some because of the lacrimal pump failure. See, some our blinking of our eyelids, that is also helping the tears to drain out into the nose. if there is any physiological dysfunction of this mechanism, this pump mechanism, that may lead to epiphora. Okay. If there is any mechanical obstruction in any part of this pathway, that may also lead to epiphora. See, lacrimal passage means from lacrimal puncta into the lacrimal nasolacrimal duct. If there is any obstruction due to any foreign body, due to any inflammation or infection, that tear will not drain out properly into the nose. So that will come out, that will overflow from the conjunctival side. These are the causes for epiphora. So there are different techniques for the examination for this condition, whether it is hyperlacrimation or epiphora. We can do some examine the area with the diffuse illumination. We can examine the puncta with a torchlight, with a handheld lens. We can examine the area, or we can apply some regurgitation test. We can do some pressure over the sac area. If some pus is coming or some water is coming, like that, we can identify that the condition. Or fluorescent dye test is there, lacrimal syringing is there, and different Jones dye test is there. And you should be familiar with these techniques. Okay. And dacrocystography or radionucleotide dacrocystography. These are some techniques for identifying the problem. Okay. So different ocular examinations are there. Clinical examinations are there for identifying the condition, whether it may be hyperlacrimation or epiphora. So it's watering of the eye. That means Srava Rogas. There are 4 different Srava Rogas are there according to the Acharyas: Shleshma Srava, Vuya Srava, Rekta Srava, Pitta Srava, and Jala Srava. Acharya Susura told about Pitta Srava. Acharya Vagbhara included Jala Srava instead of Pitta Srava. So these Srava Rogas can be compared with, according to the condition, can be compared with chronic dacryocystitis or acute dacryocystitis or epiphora. Okay. Dacryocystitis also we discussed it earlier. Epiphora is the watering of the eye. It's like that only. Watering of the eyes, there are 2 different conditions: hyperlacrimations and epiphora. Okay, these are the main etiological factors for the watering of the eye. Then comes to the next disease, Parvani, Puyalasa, Upanaha, Srava, Parvani, and allergy and Krimigrandi. Okay, Parvani. So how the Acharya, Vagbhara described about Parvani, that is a Rektaja Chedana Sadhya Vyadhi. So Vatma Sandhyasraya, Shukle, Pidaga, Dahashuni, Tama, Mudgobama, Binna, Rektam Sravadi Parvani. Vatma Sandhyasraya, Shukle, Pidaga. Means a Pidaga is arised from the Shukla part, from the sclera region near to the Vatma Sandhi. Okay. And Daha Shulini, pain will be there, Daha, burning sensation will be there, and Tamra Mudgobama, some coppery colored, and similar to that of Mudga, green gram. Okay. And Binna Rektam Sravadi Parvani, when we are cutting Dekta, blood will be discharged from that area, from that Pidaga, from that nodule. So Acharya Vagbhara described like that, which is a Rektaja Chedana Sadhya Vyadhi. Parvani is a Rektaja Chedana Sadhya Vyadhi. Acharya Susruta also described like that. Visheshan of the Rekta leads to the formation of a thin circular swelling in the Krishna Shukla Sandhi, and that is also coppery in color. Tamra, Tanvi, Daha Shula Upamanna, Rekta Nyeya Parvani, Vritta Shobha. There is a circular swelling will be erased. Jada Sandhu Krishna Shukla, near the Krishna Shukla Gata Sandhi, there will be erased a circular swelling, and Tamra in color. Dahotam will be there, Shula will be there. Okay, due to the visheshan of the Dekta Doksha, there erased a circular swelling near to the Krishna Shukla Gata Sandhi. And this type of eruptions, this swelling, we can call it as Parvani. Acharya Vagbhara also told like this only. Vatma Sandhyasraya Shukle, Pidaga, Daha Shulini, Tamra, Mudgopama, Binna, Rektam Sravadi, Parvani. So, due to the visheshan of Dekta, there is a nodule, and that is in coppery color. When it is cutting, blood will be discharged from that area. Okay, so it is a Dekta dosha, predominant disease, Dektaja Vyadhi, Chedana Sadhya Vyadhi. Okay, Parvani. And how Acharya described it? Shastra Karma is advised for Parvani Chedana karma, we have to incise and remove the part. Incise and remove the part. Chedana karma should be done. How Acharya described that? Firstly, Swedana should be done. Before doing the Chedana karma, some Swedana should be applied over the area for softening the tissues. And with the help of Bedisyantra, we have to hold and lift the 1/3 part of the lesion. With the help of Bedisyantra, we have to lift the swelling and we have to carefully exercise and remove the half part of the parvani with the Vriddhi Patra Yantra. Okay. So with the Bedisyantra, we have to hold the swelling, 1/3 of the swelling, and we have to cut and remove the half part of the parvani with Vriddhi Patra. So when we are cutting, we should be careful, and over excision that may lead to some sinus formation, some Asrunadi, and combination like Asrunadi will come. Okay, and over excision will lead to Asrunadi, some lacrimal sinus will be formed. And after the excision, some Pradisarana should be done with Saindava Madhu like that. And for removing the some remnants, some remaining parts, we can do some Lekana Karma also indicated. Okay, and some Lekana Antara is also advised in our Acharyas, like that with the Shanga, Manduki, Shukti, Spatika like that. And this is told by Parvani. So Parvani is a Rektaja Chedana Sadhi Vyadi. Okay, there is a swelling, circular swelling near the Kani is Krishna Shukla Sandhi. Krishna Shukla Sandhi. Hello. So Parvani is a Sandhigata Roga. It is because of the Rektaja vitiation and it's a Chedana Sadhi Vyadi. So Acharya told like Varma Sandhyasraya, Shukla, in Shukla region, their Pidaka will be arise with the Daha and Chula and Tamra in color, and Mudgopama with the Mudgopama that like that of a green gram. Okay, and when it is cutting Vinna, Rektam Sravati, when it is cutting, Rekta will be, blood will be coming out from the swelling. Okay, so Chedana is advised, Chedana Karma is told by our Acharyas, and this Parvani we can correlate with fectenular keratoconjunctivitis. From this picture, you can see that there will be nodular swelling near to the limbus, near to the Shukla Krishnagata Sandhi, copper in color. This type of eruptions, some circular, thin circular swelling is arise. Tamartum, Mudgopama, okay, and Daha Shula will be there. This type of eruptions will be coming near to the limbus, and we can correlate with Parvani, we can correlate with flectenular keratoconjunctivitis. Okay, then what is flectenular keratoconjunctivitis? So that is it. We already seen that in this picture, we are seen that some nodular infection, nodular affection of the conjunctiva. Okay, due to some allergic response, because how it is happening, due to some allergic response from our body, some endogenous allergens, due to the exposure of some endogenous allergens, the epithelium of the conjunctiva is responded, and some nodular swelling is coming. See, for example, what are the allergens? Mainly tuberculous proteins, staphylococcus proteins. If a patient is a TB patient, due to the TB protein inside his body, due to the allergic reaction of the TB protein, tuberculous protein, some nodular swelling will be arise near to the limbus. Okay, due to the allergic reaction of the tuberculous proteins, this type of nodular swelling will be arise near the limbus. Okay, so we can compare with that of Parvani. So this is called as flectenular keratoconjunctivitis. This allergens, this tuberculous proteins is one of the reason, and some staphylococcus proteins. See, if there is any infection in the tooth or any part of our body, due to the staphylococcus protein, there will arise some endogenous allergic reaction, and due to that reaction, some nodular swelling will be arise in the conjunctiva. Okay, near to the limbus, some nodular type of allergic reaction will be happen, and that is called as flectenular keratoconjunctivitis. And some pathology like that we can say different steps. Okay, some nodules will be arise, and if it is not treated properly, it may lead to some ulceration. After when the ulcer is healed, that may lead to some granulation and the stage of healing. Different stages are there for this pathology. And due to this nodular swelling, the symptoms will be like that of mild discomfort, irritation, watering will be there. And from we are seeing as a signs, there are three different types are there: simple one, necrotizing one, and miliary one. In simple one, only one small nodule will be there, one small flictanular swelling will be there, and that is called as a simple one. Then necrotizing one, then a large nodule that is leading for a ulcer, and necrotized tissue is formed in that area. So that is a necrotizing one. In miliary condition, multiple nodules will be seen in that area. So these are the main signs for the flictanular keratoconjunctivitis. Okay, so we have to differentiate this problem from episcleritis, scleritis, and congenital foreign body like that of granuloma. Okay, so this is a condition, this Parvani we can compare with the flictanular keratoconjunctivitis. See, there will be arise some nodular swelling due to some endogenous allergic reaction. Okay, because of some, these are the common endogenous allergens, the tuberculous protein, some staphylococcus proteins. Okay, that will create some allergic reaction in our body, and that will arise some nodular swelling in that area. Okay, so because of this swelling, there will be discomfort, mild discomfort, irritation, watering will be there. Okay, and what will the management for this therapy? And as a local therapy, we can use some steroids, antibiotic ointments. Okay, like that we can do. And specific therapy we also do for TB patients. See, for example, we already discussed that in some TB patients, due to the endogenous allergic reaction, that TB protein may cause for this reaction. Okay, so we should treat the TB. If there is any septic condition, if there is any infection in any part of our body, so we have to treat that thing. So if there is any parasitic infection, this condition may arise because of some parasitic worms inside our body. Okay, due to the parasitic worms reaction, due to the protein reaction, the endogenous protein reaction, due to the parasite, due to the worms inside our body, there may arise some this type of nodular swelling. Okay, so we have to give the treatment for the specific parasitic therapy. We have to give some krimihara chikitsa also for reducing this condition. Okay, and general measures we can do. We have to improve the health. We have to intake of high protein diet, vitamin A and C and D, like that. Okay, so Parvani we can compare. Parvani is a Raktaja Chedana Sadhi Vyadhi, and we already discussed the Chedana procedure. Okay, and the signs and symptoms told by our acharyas. And we can correlate with the flictanular keratoconjunctivitis. This flictanular keratoconjunctivitis is a condition because of allergic reaction from our inside the body. Some endogenous allergens are there due to some infection, sometimes from TB protein or staphylococcus proteins, or due to some parasites inside our body. Okay, so due to this endogenous allergic reaction, there arise some flictin, there arise some nodules like near to that limbus. Okay, so somewhat this condition is somewhat similar to that Parvani, Mudgopama, Tamra in nature, some Dahatam will be there. Okay, so we have to manage like that only. We can do some local therapies, and specifically we have to do the treatment. Okay, so Parvani we can compare with flictanular keratoconjunctivitis. Then come to the allergy. Okay, so allergy according to Susuracharya, allergy is somewhat similar to that of Parvani, and a severe form of Parvani is called as allergy according to Susuracharya. Allergy is a tasmin neva capita purva lingai, means like the above said problems like that of Parvani in a severe condition, that is called as allergy. Allergy is a Sannipadaja Asadhya Vyadhi. Among the Sandhigata Rogas, all the Srava Rogas and allergy are Asadhya. Okay, allergy is a Sannipadaja Asadhya Vyadhi. How Acharya Vagbada described our allergy? Kaninasya Andara allergy, Chobo Duk Toda Dahavan. So there will be arise a swelling, Kaninasya Andara allergy. Chobam, some swelling will be arise with Duk Toda and Dahavan. Okay, pain, some burning sensation, some irritation, itch, like that of signs and symptoms will be there for allergy. Allergy is a Sannipadaja Asadhya Vyadhi. According to Susrudacharya, the condition is almost similar to that of Parvani, but it's a severe form of Parvani. Is called, we can call it as allergy. Acharya Vagbhata described like that: Kaninasya Andara allergy. Chobo Ruptoda Dahavan. Kaninasya Andara means near to the Kaninaka Sandhi, near to the middle canthus, there is a swelling with Ruk, Toda, and Daha. So this allergy we can compare with same that of this flictenular keratoconjunctivitis. Okay, Parvani we can compare with some simple type of flictenular keratoconjunctivitis, but allergy we can compare with some miliary, multiple or necrotizing or miliary, multiple flictenular keratoconjunctivitis can be compared with this allergy. Okay, allergy is a Sannipadaja Asadhya Vyadhi. So the next come to the last, this is Krimigranthi. Krimigranthi is the last Sandhigata Roga. Okay, how Acharya Vagbhata described about Krimigranthi? Apankeva, Kaneneva, Kandusha, Pakshma Podavan, Uyasravi, Krimigranthi, Krimiyuto Artiman. There arise some nodulous eruptions where maybe in Apanga, lateral canthus or medial canthus with Kandu, Usha, and Pakshma Podavan with itching and with some burning sensation and with Pakshma Podavan. There will be falling of the eyelashes. Okay. So this type of condition, that is because of the krimi, some parasites that is creating this problem. Okay. Apankeva, Kanineva, Kandu, Usha, Pakshma Podavan, Puyasravi, Krimi Grandi, Krimi Yuto Artiman. Okay. Puyasravi, some first discharge will be there, and there will be some Kandu, Usha, itching will be there, some increased temperature, burning sensation, and Pakshma Podavan, the cilia, the eyelashes will be fall off. Okay, that may arise near to the Apanga or Kanina. So some cystic swelling associated with itching found in the junction between eyelids and eyelashes. Okay, various types of krimis, some parasites are making this problem. Okay, so Acharya Vagbhata described like this: Apangeva, Kanineva, Kandusha, Pakshma Podavan. So this is a Kabaja Sadhya Vyadhi, Kabaja Vedana Sadhya Vyadhi. Krimigranthi is a Kabaja Vedana Sadhya Vyadhi. So before doing Vedana Karma, like that we have to do some Svedana. Okay, and incision can be done at the lid margins. Then after the proper Vedana, we can do some Pradisarana, and we can do some, make some paste, medicinal paste with Triphala, Tutta, Saindava, honey, and we can apply over that area. Okay, so Krimigranthi, it's a condition because of the vitiation of the Kapha dosha, so the Vedana Sadhya Vyadhi, and the krimis, the parasites that are causing this problem, and maybe Apanga or Kanina Sandhi, and causing some Kandu, Usha, Pakshma Podavan, and creating some cystic swelling over that area, and Puya will be discharged, some first discharge will be occurred from that area. Okay, this is called as Krimigranthi. Acharya Susruta also described like that only. Krimigranthi Vartmana, Pakshmanascha, Kandu Kuryu, Krimaya Sandhi Jataka, Nana Rupaha, Vartmaha, Chuklasya Sandhu, Charandu, Andarnayanam Dukshayandi. Nana Rupaha, in different aspects that will affect the Vartma Shukla Sandhi also. Okay, generally that is affecting Pakshma Vartmagata Sandhi. When it is not treating properly, that is affecting Vartma Shukla Sandhi also. Okay, and inside the inner structure of the eye also. So Krimigranthi is a Kabaja Vedana Sadhya Vyadhi. Vedana Karma, Shastra Karma can be done after the Svedana Karma. And after the Vedana Karma, Pradisarana should be done. This is a surgical procedure for this Krimigranthi. So Krimigranthi can be correlated with blepharitis. See, Krimigranthi can be correlated with the blepharitis. What is blepharitis? Blepharitis is a condition subject to chronic inflammation of the lid margin. Before that, you have to see this is a cross section of the lid margin. Here you can find that sharp posterior border of the lid margin and a round anterior border of the lid margin. From the anterior round border, eyelashes are originated, and the posterior border, there is a sharp border is there, and meibomian glands, the bluish colored gland that is opening near to the posterior border, and the eyelashes that are originating near to the anterior round border. Okay, so blepharitis is a condition that is because of the subacute or chronic inflammation of the lid margins. Okay, the lid margin is inflamed. Okay, that condition is called as blepharitis. This clinically can be correlated with blepharitis. So there are different clinical types are there: bacterial, ulcerative, means bacterial or ulcerative. Second one is seborrheic or squamous one. Third one mixed one. Okay, and the fourth one posterior or meibomitis, and fifth one is parasitic. So one by one we have to see. Bacterial or ulcerative blepharitis, that is because of chronic infection of the lid margin. Okay, because of the infection due to the causative organisms, some Staphylococcus, Streptococcus, due to that organism, the infection will be created at the lid margin, and there will be suppurative inflammation. Pus formed inflammation will be there at the ciliary follicles. So there are two different glands, and there glands of Zis and mole related to the ciliary follicles. When the infection is affecting the cilia, there will be suppurative inflammation will be there near to the ciliary follicles, and that is creating this ulcerative or bacterial blepharitis. Okay, due to that inflammation, there will be definitely chronic irritation, itching, photophobia, lacrimation, and because of the pus discharge, the cilia will be sticking together. Gluing of cilia will be there, and photophobia, like that of symptoms will be there. Okay, from this picture you can see that there are pus discharge, yellowish pus discharge, crust formation will be there, and due to the pus discharge, the cilia are glued together, stick together. Okay, and the lid margin is inflamed due to the infection. So this condition is called as bacterial or ulcerative blepharitis. So some yellow crust you can see at the near to the eyelashes, and when we are removing the yellow crust, some bleeding points can be seen at the lid margin. Okay, the yellow crust are deposit at the root of the cilia, and when we are removing the crust, the yellow crust, when we are removing that, some ulcers can be seen, and that will be bleed easily. Yellow crust due to the infection, pus discharge will be generated, pus discharge from the cilia, and then due to that the cilia is stick together, glued together. When we are removing the yellow crust, we can some ulcer part will be there beneath that crust, and that will be bleed easily. These are the signs. Okay, and due to the inflammation, the lid margin that will be thickened. Okay, and some dilated blood vessels also can be seen, and due to the infection and the inflammation at the lid margin, at the eyelashes, the falling of eyelashes will be there, means Pakshma Podavan. Here we already discussed that Kandu Ushma Pakshma Podavan. The eyelashes will be fall off. Eyelashes will be fall off. So Pakshma Podavan. Here also due to the inflammation or infection of the bacteria. See, due to that also the cilia or eyelashes will be fall off, and after when it is cured properly, sometimes the new eyelashes will be coming, otherwise sometimes it won't come. When it is coming, sometimes it may be in misdirected form. Sometimes it may be come, when it is coming, that will be in misdirected, that will be won't be in a normal direction. Okay, so for ulcerative or bacterial blepharitis, what the treatment we can do, we can keep the lid margin hygiene. We have to keep it clean properly. So we have to do some, we have to soften the crust, and we have to remove the crust from that area with the 3% sodium bicarbonate. We can remove the crust from that area, and after that we can apply some antibiotic, anti-inflammatory ointments. Okay, and we have to do some, here apply some antibiotic eye drops and topical antibiotics, steroid ointments, steroid eye drops we have to do, and we can use some ocular lubricants also. So due to the infection, due to the Staphylococcus, Streptococcus infection, there arise some infection near to the eyelashes, and that will cause some suppurative inflammation near to the eyelashes, and that will create some yellow crust formation near to the eyelashes. Okay, there will be itching, pain sensation, irritation, and when we are removing the crust, and their ulcer will be formed. Ulcer can be seen beneath the crust, and that will be bleed easily. Okay, and eyelashes will be fall off, and when it is treated properly, new eyelashes will be come sometimes. Otherwise, it won't come. If it is coming new eyelashes, that will be in misdirected form. That won't be in a normal direction. Okay, so these are the common treatment we have to do. And next one is seborrheic or squamous blepharitis. So what are the causes for this seborrheic or squamous blepharitis? There are lots of causes are there. Metabolic causes are there, hygienic factors. If a patient is taking food, not taking the food properly, the whether the patient is not taking the food properly, or whether not keeping the area clean and dry, then this condition will come. Okay, metabolic causes, when we are not taking the proteins, carbohydrates, and minerals properly, when we are not taking a complete diet, then this condition may arise. Okay, and due to some eye strain and other condition, may be dandruff from the scalp. Okay, when a patient is having scalp dandruff, it may deposit into the eyelashes, and that may cause this seborrheic or squamous blepharitis. Okay, these are the main etiological factors. And the symptoms, what are they? In seborrheic or squamous blepharitis, we can see some whitish material, some whitish powder-like materials that is deposited near to the eyelashes. Okay, near to the lid margin, and due to that discomfort, irritation, watering, falling of eyelashes will be there. So yellowish crust will be seen in ulcerative or bacterial blepharitis. Here, whitish type of discharge, whitish powder type of deposits we can see at seborrheic or squamous blepharitis. Okay, so when we are removing the scale, there won't be that much problem. But in ulcerative blepharitis, when we are removing the yellow crust, some ulcer points can be seen that will bleed easily. But here, the seborrheic or squamous blepharitis, when we can easily remove the deposits, whitish deposits. Okay, but there won't be that much of ulcer or bleeding points won't be there. Okay, and only hyperemic, some greasy type of area will be there when we are removing the whitish deposits. Okay, and here also eyelashes will be fall off due to the deposition, but the eyelashes will come when we are subsiding the problem, when we are treating it properly. The eyelashes will be come out properly, and that will be healthy one in a normal direction. Okay, these are the main signs and symptoms for seborrheic or squamous blepharitis. In this picture, you can see that the whitish material that is deposited near the eyelashes. Okay, eyelashes. And the etiological factors are different due to some our metabolic factors. When we are taking the food properly, due to some eye strain, whether a patient is having some refractive error, due to some eye strain, due to some hygienic factors, and due to some dandruff of the scalp, this problem will arise. Okay, this seborrheic or squamous blepharitis may arise. So what are the treatment can be done? So generally we have to do the problem, we have to address the problem, we have to give the proper food. Whether he has some refractive error, we have to correct that things, we have to make the patient hygienic that area, we have to clean that area, and we have to give balanced diet, and we have to, whether it is due to the seborrheic of scalp dandruff, we have to give medicines for that also. Okay, here also we can apply some 3% sodium bicarbonate, or some baby shampoo also we can apply over that area, and we can do some antibiotic steroid ointments also we can apply over that area. Then comes to the next blepharitis, posterior blepharitis or meibomitis. In some condition, the mixed one means ulcerative blepharitis and this squamous type of blepharitis are mixed together. So that is a mixed type of blepharitis. And the third one is posterior blepharitis or meibomitis. So in this picture here, you already seen that meibomian glands are open at the lid margin near to the posterior sharp border. The meibomian glands, the openings of the meibomian glands can be seen near to the posterior sharp border. Okay, so in posterior blepharitis or meibomitis means that is the inflammation of the meibomian glands. That may be a acute condition or a chronic condition. Okay, acute or chronic inflammation of the meibomian glands leads to posterior blepharitis. Okay, in acute inflammation, acute meibomitis may be caused because of the staphylococcal infection, and that will be painful. Swelling will be there, and pressure. When we are applying some pressure, some pus discharge will be coming out from that meibomian gland. If it is chronic one, okay, chronic meibomitis and meibomian gland dysfunction will be there due to some skin disorders, acne, rosacea, some seborrheic dermatitis, some chronic meibomians will happen in this picture due to the chronic infection of the meibomian gland. The openings of the meibomian gland near to the sharp posterior border is enlarged in and white dot like it will appear. Okay, the openings of the meibomian gland in chronic meibomitis, the openings of the meibomian gland near to the sharp posterior border of the lid margin that will be swollen and some whitish nodule like it will appear. Okay, and chronic irritation will be there, burning will be there, itching, lacrimation, this type of symptoms will be there. And like in this picture, we have seen that there will be a white frothy secretion present on the lid margins. Okay, so openings of the meibomian gland will be prominent and some thick secretion may be discharged. Okay, and when we are everting and examining the palpable conjunctiva, some vertical yellow streaks can be seen. Okay, because of the inflamed meibomian gland. Okay, the meibomian glands are arranged in vertical manner. Okay, so when it is a chronic meibomitis, when we are everting the lid and we are examining the palpable conjunctiva, we can see some parallel vertical yellow streaks of the shining yellow streaks of the meibomian gland can be seen through the conjunctiva. Okay, these are the signs and symptoms of chronic meibomitis. And here also we can do lid hygiene, topical antibiotics, topical steroids, and ocular lubricants also we can do. Okay, so this is posterior blepharitis or meibomitis. Then comes to the parasitic blepharitis. So our Krimi is in Acharya is told that due to the Krimi, due to some parasites, there arise some swelling, some nodules in the Sandhi. Okay, and there will be itching and some discharge will be there. Okay, here parasitic blepharitis or lash infestation. So due to some parasites, mainly because of the crab louse. See in this picture you can see that there are different louse are there. One is head louse and body louse, and the third one is crab louse. And the crab louse is affecting the eyelashes and is attaching to the cilia, eyelashes, and near to the eyelid, to the root of the eyelashes they are attaching, and they are creating the parasitic blepharitis. Okay, or lash infestation, mainly because of the crab louse. So the condition is like that: chronic irritation, burning sensation, lacrimation also will be there, and we can see with a handheld lens, we can see the louse, we can identify the crab louse. Okay, and the lid margin will be inflamed, and the eggs of this louse, crab louse also seen. That will be also adhere, that will be attached with the roots of the eyelashes. So when we are, what are the treatment we have to do? We have to mechanically remove the area, and we have to delouse the patients. We have to some antibiotic ointments. We have to delouse the patients, means we have to delouse the total family of the patients. Okay, when the patient is having a problem of this parasitic blepharitis, we have to give treatment for the whole family for delousing the family. Okay, this is from this picture you will identify the crab louse, and that is attaching to the eyelashes, the roots of the eyelashes. Okay, so there are different types of blepharitis are there: Krimi Granthi, the Sandhigata Roga, Kabaja, Vyadhi. Krimi Granthi can be correlated with blepharitis. Okay, Krimi Granthi is a Kabaja Vyadhi, and it can be correlated with blepharitis. Ajay also will describe about this Krimi Granthi due to the Visheshana Kapha, due to the some Krimi, some swellings will be arise, some puya will be discharged from that area. Okay, Kandutam will be there, burning sensation will be there, some increased temperature will be there, and the Pakshma Podavan, eyelashes will fall off. Okay, this condition can be seen in blepharitis also. So we discussed about blepharitis. Blepharitis is the condition in which acute or subacute or chronic inflammation of the lid margin. There are so many reasons are there, causative factors are there, clinical types are there, means ulcerative or bacterial, seborrheic or squamous, in mixed one also there, parasitic, and posterior or meibomitis. So this Krimi Granthi can correlate with blepharitis easily. Okay, so discuss about the Sandhigata Rogas. There are 9 different Sandhigata Rogas are there. So, Puyalasa, Upanaha, Srava, Parvaniga, Allergy, and Krimigrandi. Okay, Puyalasa, Upanaha, Srava, Parvaniga, Allergy, and Krimigrandi. Puyalasa, we can call it diacrosis status. Puyalasa is described like that. Puyalaso, Vrana Sushma, Shobha, Samramba Purvaga, Kanina Sando, Atmai, Puya Savi, Savedana. Okay. We discussed about Puyalasa, the Sannipadacha Vyadi is affecting the Kaninaga Sandhi, Vyadana Sandhi Vyadi. Okay, so 9 different Sandhigata Rogas are there. Among them, 5 are Asadhya. What are they? The 4 different types of Srava Rogas and allergy. And remaining the 4 are Puyalasa, Upanaha, Krimigrandi, and Parvani. Okay, Puyalasa, Upanaha, Krimigrandi, and Parvani are the Sadhya Rogas. Okay, these are the 9 different Sandhigata Rogas. Okay, so sometimes questions may ask about, write about the Sandhigata Rogas, or sometimes may ask about, write about the Sadhya Sandhigata Rogas, or Asadhya Sandhigata Rogas, or sometimes ask about Srava Rogas. Okay, so 4 different types of Srava Rogas are there. Puya Srava, Shleshma Srava, Lekta Srava, Pitta Srava, according to Susrudaacharya, and Vagbhadacharya included Jalasrava instead of Pitta Srava. All these Srava Rogas are Asadhya Rogas. All these Srava Rogas are Asadhya Rogas. And these Srava Rogas we can correlate with, according to the condition. Sometimes we can correlate with the diacrosis, and sometimes we can correlate with the watering of the eye. Means sometimes hyperlacrimation or epiphora. Okay, we discuss about this correlations also. Okay, so Puyalasa, Upanaha, Srava, Parvani, and allergy. Krimigrandi. Parvani is a condition. P. Puyalasa, Upanaha, Srava, Parvaniga, allergy, and Krimigrandi are the 9 different Sandhigata Rogas. Okay, so for Acharya Susruta and Acharya Vagbhada, the number is same and the name is also same. Only mild difference is there for Srava Rogas. 4 Srava Rogas are there for 2 Acharyas. Pitta Srava for Susruta instead of Pitta Srava, Acharya Vagbhada included Jalasrava. Vata dosha is predominant for causing Jalasrava. Okay, these are different types of Sandhigata Rogas. Netra Srava Rogas. Parvani also we discussed. Parma Sandhyasraya, Shukle, Pidaga, Daha Shulini, Tamra, Mudgopama, Vinna, Rektam Sravadi, Parvani. Parvani is a Rektaja Chedana Sadhivyadi. See, from this picture you have to remember that Parvani. Mudgopama, green gram like that of nodule will be there due to the vitiation of the Rekta and Chedana Sadhivyadi. And sometimes it will near to the Krishna Shukla Gata Sandhi. Okay. Parvani, Acharya Susruta discovered this Parvani is appearing near to the Shukla Krishna Gata Sandhi. Okay. This Parvani also we can call it the flictonular keratoconjunctivitis. Flicton means there is a nodules arise, nodular swelling will be there at the conjunctiva because of the allergic response, endogenous allergic response. Okay, sometimes maybe due to a TB protein or staphylococcal protein or due to some parasitic protein. If there is a worm infestation in some children you can find this problem, whether the children is having some worm infestations, there arise this flictonular conjunctivitis. Okay, so for treating this condition we have to give some Krimihara chills also. Okay, so Parvani. And allergy is an Asadhya Vyadi, Sannipadaja Asadhya Vyadi. According to Susruta, this is severe condition of Parvani. So we can correlate with this flictonular keratoconjunctivitis itself. Different types of flictonular conjunctivitis is there. Simple one are there, necrotizing are there, and multiple. So multiple or necrotizing you can correlate with this allergy. Okay. And Krimigrandi we already discussed. Krimigrandi Apangeva, Kanineva, Kandu, Usha, Pakshma Podavan, Puya Sravi, Krimigrandi, Krimido, Attiman. So, say kabaja, vedana sadhi vyadhi. Okay, and this can be correlated with blepharitis. Different types of blepharitis are there, and different conditions are there. Okay. So I think today we can conclude this section. We just go through the topics. Only this is a simple topic. Just to go through the Sandhigata Rogas, 9 diseases of different diseases. Just to go through and with the picture, just remember the signs and symptoms and just to correlate with the modern aspect with the diseases, what they told in modern aspect. Okay, then it will be easy for you to remember. Shall we conclude the section?